Okay, I want to thank everyone for coming. If we could quickly grab a meal and be seated so we can keep everybody on time today. We have a really exciting workshop with all international speakers planned for you, and we really want to get this going. Thank you. Okay, we're going to get started. My name is Bill LaRochelle, and I'm the Scientific Director for Roche Sequencing. And I want to welcome and thank everyone for this great turnout that we have here today for our workshop. If you were at our workshop yesterday Roche talked about its sequencing strategy, where we are assembling the puzzle of a complete workflow solution. So by this, I mean we talked about our front-end library prep and target enrichment technologies, and also our back-end software solutions with Bina. And here today we're going to talk about our smart sequencing solution. And the title of our workshop, of course, is Revealing the Unknowns in Medical Research with Long-Read Smart Sequencing. And now what I'd like to do is invite our president of Roche Sequencing, Neil Gunn, for a short welcome. Neil?
Thank you very much, Bill. Good afternoon to everyone, and on behalf of PacBio and Roche, I'd like to welcome you to this AGBT workshop. It's a real honor, great pleasure for Roche to be able to sponsor this event. We're very honored to have PacBio as our partners to be presenting information jointly on the clinical applications of the smart sequencer. Before we get into the session, I want to thank all of you. It's great to see so many collaborators and friends out in the audience. And I want to just really explain a couple of points around Roche and the journey and the vision that we're undertaking here within sequencing. All of you know Roche, I'm sure. Very large organization with pharmaceutical and the oncology franchise as the world-leading franchise. And then obviously within the diagnostics as the world's leading IVD diagnostics. And that gives us a really unique opportunity as Roche to bring together the science, particularly around infectious disease, genetic disorders, and ultimately oncology, to put that together to really help drive medicine. Within the diagnostics area, we have a central diagnostics group, but also unique for Roche and unique within the industry, we have this combination of tissue diagnostics, molecular diagnostics, and sequencing. And that together is really unique, and I think really plays and interfaces to what we're trying to do and what we're trying to lead. Within sequencing, as Bill just mentioned, we're putting together the vision, and our vision truly is to make sequencing accessible enough for routine clinical practice. And that's really the emphasis of where we are going. We are the leading diagnostics to take products into the clinic. We do see sequencing moving towards the clinic, and I really want to encourage our organization to engage with all of you to see how we can speed that up, how we can move that forward so that we can take it into this routine practice. My role is to head up the sequencing organization within Roche. It's a great honor to do so. And we really have to do it through collaborations and partnerships, as well as some really foundational organic research and development. But I want to emphasize the partnerships. I think the partnership we have with PacBio is really founded on the need for research and also the need for clinical research and clinical translational research. And that's what we want to talk about today. So it's my great pleasure to hand over to Bill once more to introduce our speakers, and please enjoy the afternoon. enjoy the session, and we'll hopefully engage with you later on today at the booth as well. Thank you very much. Thank you.
Okay, thank you, Neil. Just a reminder, just a little bit of a legal and regulatory business, that all of the instruments we're showing here today are for research use only. The second thing I wanted to remind people of is that the instruments, both the sequel, are in the PacBio and the PacBio suite, and the Roche version of the Smart Sequencer is in the Roche suite, and we're right by next to each other downstairs in Del Lago. So if people want to stop by and check out the sequencers and look at them. Now, Neil will also be available with the Roche executive team tonight after 6 to 6:30 in the Roche suite Del Lago 1, if you have any questions for Neil or would like to talk to him individually. So now it's my pleasure to introduce the first speaker in our program. He is Ewan Ashley. So Ewan got his MD, PhD from Oxford, and he did a postdoc at Stanford. And what's particularly impressive about Ewan is he led the team that performed the first clinical interpretation of a human genome. So this publication actually was featured at a Smithsonian exhibit, and in 2013 he was recognized by President Obama at the White House for this achievement. He's also the co-founder of Personalis. Now, on a lighter note, probably what you don't know about Ewan is that he plays the saxophone, and he was part of a 4-man saxophone band. And another hobby that Ewan has is basically doing personal research, being a true Scotsman, doing personal research on single malt Scotch whiskey. So, Ewan, I turn it over to you. He's going to talk to us today about moving towards precision medicine.
Well, thanks, Bill, and it's wonderful to be here. Thank you for giving over your lunch hour to listen to more science. It's very exciting to be at AGBT, as always. I'm going to be talking about precision medicine, which is something that not many of us had heard of prior to last year, but I'll show you what happened after that. These are my disclosures. As you'll see, I'm from Stanford. I'm a cardiologist, a geneticist, and I run the clinical genomics service at Stanford. So I spent a lot of my time thinking about taking the technologies that we all enjoy that have been used for the most part for genomic discovery in populations and thinking about applying those to individual patients. And that use case leads to a number of questions about exactly the way we should do that. So we spent much of the last year looking at President Obama pointing at Eric Green's DNA model. And this was the phrase that you might remember from Obama as he announced the Precision Medicine Initiative. I'm sure, like many of us, you may be in the category of having spent much of the last few weeks writing towards the grants that came out of this announcement, including to the very last minute since they're due next week. But he said, "I want the country that eliminated polio and mapped the human genome to lead a new era of medicine, one that delivers the right treatment at the right time." And, you know, this wasn't not a new thing for Obama. In 2006, when he had much less gray hair, he introduced a bill that didn't make it out of committee that had many of the aspects of the Precision Medicine Initiative already in it. And as to whether Obama actually thinks about this, I think Kathy Hudson answered that question pretty well at one of our Stanford conferences, the Big Data for Biomedicine conference, when she said the president gets up in the morning and thinks about ISIS, the economy, and the Precision Medicine Initiative. So this is really something that Obama focuses on. This is not something that was slipped into the State of the Union and that's just happening. It's something that he is really focused on and interested in. And in fact, I mentioned that prior to the announcement, we mostly use the term personalized medicine. As you can see from this Google Trends slide, shown in blue is personalized medicine, the number of Google searches over the last few years. And at the point that Obama announced the term precision medicine, you can see the number of Google searches for precision medicine immediately rose and equals approximately that for personalized medicine. Now, I will use these two synonymously. I was asked to give a talk in the UK recently about stratified medicine, and I couldn't remember what that is because it's many years since I've been in the UK. So you can see that it's only really used in the UK by that little blue dot in the middle of the screen. Turns out it's, as far as I know, the same thing. So here's how I'm going to define it for the purpose of the next 20 minutes. Precision medicine is the idea of targeting or preventing disease by measuring it more precisely. And Obama used a number of examples. This was one of them. Cystic fibrosis is categorized at a molecular level in a way that it never used to be. Many genetic diseases this is true for. And in particular, the point of subcategorizing a disease, in this case, 6 different categories defined by example variants and defined by the functional effect on the CFTR protein. The point of defining it in that way is so that you can then target drugs much more selectively, precisely, and effectively. Another example, and one that, of course, is on everybody's lips right now, is precision oncology. And the number of ways that the sorts of technologies that are being discussed at this conference could really impact oncology is very significant. You can think at the DNA level, of course, germline risk is something we've done for many years, thinking about driver mutations. But in the new era, we can think about neoantigens, we think about HLA typing, we think about T-cell repertoire sequencing. And of course, at the RNA level, we're increasingly looking at the T-cells and the tumor cells themselves and thinking about what the transcripts actually expressed there are and thinking about the relevance of those checkpoint receptors and ligands for therapy. Liquid biopsy, of course, those of you who were at Jay Flatley's talk this morning would have heard about GRAIL and the great interest in extending the work from NIPT that has been done in the prenatal arena towards cancer. So the landscape of genomic medicine is pretty large. And you can see on this slide a number of different places that we either are working at genomic medicine or we're working towards it. And many of them are actually here. For rare or novel disease, we've been using exome and genome sequencing now for years in the clinic. For circulating cell-free DNA, NIPT is actually in the clinic. For cancer sequencing, it's on its way. Pharmacogenomics is on its way. I think there is still no question that this is transformative. And in fact, within medicine and within at the bedside of the patient, we're already seeing these changes. But the message I'd like to leave you with today, if it's only one slide, is that precision medicine also needs to be accurate medicine. And you can think about the slides that you may have learned the first time you learned these words and the difference between precision and accuracy. Something can be precise but not accurate, and accurate but not that precise. Defined by the the National Research Council document, precision medicine should really include both of those. But I think we have not spent enough time thinking about accuracy in genomics. And I spend a lot of time thinking to myself, what is the ideal genome diagnostic today for my patient? If I wanted to order a test, and I do this every week, what would it be that I actually order that would give me the most amount of information for the least cost? And there are some challenges with the current approaches. I'm going to lay some of those out and hope that maybe some of the